Welcome back to the Dry Fasting Club. I'm Yannick Wolf, and today we are going to be talking about treatment basics, the next part of the T3 therapy. We're going to be walking through things like what is the actual amount of T3 that you should be taking? How do you start? How do you ramp up? What are safe levels? What you need to watch out for? And questions like, will T3 damage my thyroid? Do I need to take it forever? Where do I get the T3? And we'll finish off on what are T4 test doses for and how you can fine tune it if you are having some sort of side effects or any problems during any stage of the T3 therapy. So this is an important one. Strap yourselves in. Okay, so we've got treatment basics. And the first question is, what is the T3 protocol exactly? So think of it as either a short term or an extended term, but we'll just go with a short term because most people want to go through it quickly, of course. So a short term is something like 4 to 12 weeks. 4 weeks is pretty crazy fast. Technically, you can pull it off if you know exactly what you're doing, but I don't expect people to do that on their first run. 12 weeks is the standard, 3 months. That gives you time, gives you about a month to ramp up. And usually people start to feel so much better when they hit their temperatures on T3 that they like to stay in that zone for a long time. And I think it's mentally helpful to continue once you find your perfect level, to continue for a little bit there. While your levels are optimized, good things are happening in your body. That's why sometimes you require to do a few cycles of this. For anybody knowledgeable in the fasting space, a lot of times people will tell you that you need to fast multiple times to get the right benefits. You know, like you do, even when people are doing the extremely long ones, they'll go on a fasting retreat for 9 and do a 9-day dry fast. And then they're told that if it doesn't resolve over the next few months, they need to quickly jump back into another 9-1 to sort of dig deeper at the root issue. And the same thing can occur with the T3 therapy. There is a lot of benefits that occur during your cycles, but sometimes you need to repeat them to get further and further benefits. And the beautiful thing about T3 therapy is that when done correctly, each cycle should improve your thyroidal system, which is the exact opposite of every extended fast that you do, which worsens your thyroidal system unless genetically you are able to bounce back really quickly. And it also depends on the diet and how you refeed. Okay, so the next question is T3 therapy safe if thyroid tests are normal? And the answer is yes. T3 is a natural hormone present since birth, essential for health. No evidence it poisons or damages when used properly, and it rests and resets the system. Similarly to birth control for cycles for women. So that's why I really like T3. It's one of the only things in bodybuilding that is known not to cause permanent effects. Bodybuilders have been using T3 for decades. There's one more hormone or peptide that has a similar profile and is also used in that community, and that's human growth hormone. Another thing that naturally you're worried that, oh, if I use this, I'm going to ruin my own endogenous supply of that hormone. Yes, when you're on it, it lowers your own production, but as you wean off of it, both of these hormones have a beautiful rebound where the system can come back fully. And often, if you have done a lot of healing while on it, it can come back even better if you've healed underlying issues in the body. Okay, the next question is T4 more important than T3? And the answer is no. A boy with no thyroid raised on T3 alone grew normally into adulthood without T4, proving that T3 is sufficient by itself. And also, this gives us something to think about. When T4 is the most prescribed hormone medically right now, they pump you full of the storage hormone. And if your body has issues with converting it to T3, which a ton of people do, I think a huge amount of people that only see mild improvements on T4 would do so much better if they had T3 added into it. And then we've got people with actual chronic illnesses that need the T3. T4 will not help at all, and often it'll make things worse. The next question is, will T3 damage my thyroid if labs are normal? No, studies show no harm to healthy glands. It temporarily rests the system to restore function. Okay, that was similar to the 2 questions prior. The next one is, do I need T3 forever once started? Also answered, but the answer is no. Even hypothyroid patients can wean off of T3 and reset their metabolism. 60 to 70% of patients stay off long term. So what happens to the other 30%? I think the other 30% may have some sort of illness that forces them to keep coming back to it. Maybe they have some other thyroid issues. Maybe they have a fungal infection, a persistent one that requires antifungals on top of T3 therapy to fully eradicate, because if you don't, you get these benefits from the T3 and then you wean off, and then over time you need to do it again. That's why in the Scorch protocol, there's a parasite, antiparasitical, and antifungal protocol, because I believe these two are the most persistent problems, whereas viruses and bacteria are easily solved once your immune system comes back online with enough energy, enough temperature, enough fasting. What's the next question? What's the difference between sustained release T3 versus regular? Okay, this is a good one. So I call it SRT3. That's what usually sustained release is branded as. It means that it's compounded in a way that it releases very slowly. You know, it's in a matrix, a cellular matrix that doesn't dissolve right away when it hits your gastrointestinal tract. This is very important because your thyroid produces something like 2 to 3 micrograms of T3 per hour and releases that in the body. And yes, the T4 is a little bit more. And yes, it does convert peripherally, but it just proves that we are not meant to dump T3 into the body in a way that a dump truck just dumps this whole load into the ocean. The whole T3 therapy system really truly thrives when you get access to slow release T3 and you create a nice gradual curve and keep it consistent throughout the hours instead of having these peaks and troughs going up and down when you do take the pills. And it also is a huge peace of mind. A lot of people will get T3 and they'll break it up into quarters, for example, and take them throughout the day, maybe every 3 hours. They try and balance it, 2, 3, 4 hours, maybe every 6 hours, but it is still not comparable, because I would advise, if you have slow release T3, to still spread it out. Let's say you have 10 microgram capsules, right? I wouldn't take 3 in the morning. If I really wanted to optimize everything, I would still spread it out the same way people are trying to do with regular T3, but now you've got slow release. So you're way ahead of them. You have basically created a way for you to completely optimize the absolute best way to do it. The next question is, where do I get slow release T3? Okay, so slow release T3 usually is gotten from a compounding pharmacy. One, you have to get a prescription from T3 from a doctor. This is already a very complicated task, especially in a medical world that pushes T4. And you can read about the whole T4 lobby when Synthroid came out and how they tried to push natural desiccated thyroid out to bring in T4. And they really started rewriting textbooks, really forcing the medical community to accept T4 medication, solo T4. It was to their benefit, to the pharmaceutical industry. And the arguments were that you could perfect the dose. You knew that every dose was consistent. And the argument was that if you got it from a pig's thyroid or bovine thyroid, that you couldn't certify that you were getting the exact amounts that were listed. Let's say it was supposed to be 9 micrograms of T3 in each capsule, but you were only getting 8 in this one and maybe 10 in the other one. So they weren't perfected. I don't think this is a great argument, but it is a logical argument that won out with the lobbying and pushing. Okay, so what I was getting to is that it's hard to get T3 prescribed in the first place. You need to know your doctor. You need to have an endocrinologist that really knows their stuff. And they have had to read supplementary books and gone beyond the regular medical school teaching. And a lot of them don't like to do that. They're honestly, they're lazy and they're running a business. You know, they need to get you in and out as fast as possible so they can go to the next customer, client, patient. And they don't know about it. But if you can find one, that's great. They're going to have to write a specific custom script for you to go to a compounding pharmacy to get slow release. But normally if they allow you to experiment, they'll just prescribe T3, something like liothyronine. Cytomel, I'm pretty sure, is the most popular brand. But if you can get it slow release, it is so much better. The more you read about this T3 therapy, the more you'll understand why I'm saying that. It's really, really worth it. How do I find a doctor for this? Very difficult. You're kind of going to become your own doctor. Maybe if you learn enough, you'll be able to educate your doctor if they're open to it. The books I recommend are the CT3M book, which is the circadian T3 method. You want to get Stop the Thyroid Madness. That's a very fun, easy book to read as well. And another fun, easy book from a doctor from something like the 1960s is Hypothyroidism, the Unsuspecting Illness. Highly recommend those 3 books. Okay, second last question is, can I start this therapy while on T4? The answer is yes. You wean off of T4 over 3 to 10 days while slowly ramping up T3 so that there's no crazy switch on the body. And honestly, you're just going to improve. You're just going to start feeling better and you won't have any sort of crash. Often need less T4 once you start the T3. So you're going to see that. It's a little bit of experimentation. You're tracking your temperature and you're tracking your heart rate and you're trying to balance it. Last question, what's a T4 test dose? The answer is if T3 is causing any anxiety or palpitations, you take a little bit of T4 to buffer it. So the answer says mid-morning to buffer. Repeat as needed without the full T4 commitment. Most patients' clients doing Scorch protocol don't have access. Okay, so I'm basically saying you don't have access. So if you are unable to get access to T4 and you already have T3, I recommend having a bottle of NDT, which is natural desiccated thyroid. In the US, you can order something like Ancestral Supplements Beef Thyroid, which I believe claims to have the T4 and T3 inside of it active, and it's not, removed as most other NDT thyroid supplements do, especially in Canada and outside of the US. But if you can get that one, there's enough T4 in there to use that to kind of hack your way for T4 and buffer anxiety and palpitations on T3. So while you're doing your T3 therapy, you hit a snag and you suddenly start feeling really weird. You take a beef thyroid to see if the T4 can smooth everything out. Hope that makes sense. All right, that's going to be it for this one. That was treatment basics for the T3 therapy. Good luck. Good luck on your dry fasting journey. See you later. They want you sick. They want you dependent. They want you in debt. The first act of rebellion is to get your health back. I came back from the dead. I commune with the dying and sickly daily. The world is not what it seems. You can liberate yourself. Subscribe if you want access to a private Discord server to support the site, to get a discount link for medications like growth hormone and slow release T3, and access to the Miro board with huge brainstorm charts. Your health is just around the corner.